Welcome everyone.
Today we're going to dive into one of the most important procedures you'll encounter in pediatric cardiology, the Glenn procedure. This isn't just about knowing facts. It's about understanding how to provide excellent nursing care for some of our most complex cardiac patients. By the end of our time together, you'll understand not just what this procedure is, but why it matters and how to recognize when something's going wrong.
What you'll learn today: purpose and mechanism of the Glenn procedure, timing and patient selection, early and late complications to watch for, nursing care priorities, role and stage palliation pathway. Speaker notes: these objectives aren't just academic, they're directly tied to the clinical decisions you'll make at the bedside. Understanding the mechanism helps you anticipate patient responses. Knowing the complications helps you catch problems early. And understanding the bigger picture helps you support families through this complex journey. Normal heart versus single ventricle anatomy. Key points: single ventricle defects affect 1 in 5,000 births. One ventricle must do the work of two. Without intervention, most children don't survive infancy. Requires staged surgical approach. Let's start with the basics. In a normal heart, you have two pumps working together. Right ventricle sends blood to lungs, left ventricle sends blood to body. In single ventricle defects, we essentially have one ventricle trying to do both jobs. Imagine trying to run two garden hoses off one spigot. It doesn't work well long term. The Glenn procedure is one step in helping solve this plumbing problem. The Glenn procedure creates a direct highway from the superior vena cava to the pulmonary artery. Think of it as surgical plumbing. We're rerouting traffic to make the system more efficient. The blood from the upper body now flows directly to the lungs without the heart having to pump it there. This reduces the workload on that single functioning ventricle. The Glenn is the middle child of a three-stage process. We can't go straight to the final repair in newborns. Their bodies aren't ready. Stage 1 gets them through the newborn period. Stage 2, our Glenn, sets them up for success. Stage 3 completes the circulation separation. It's like building a house. You need a solid foundation before you can put up walls, and walls before you can add a roof. Timing is everything with the Glenn procedure. Too early and the lungs aren't ready to handle passive blood flow. Too late and the single ventricle starts to fail from overwork. We're looking for that Goldilocks zone. Not too early, not too late, but just right. The cardiology team watches these kids like hawks, monitoring growth, oxygen levels, and heart function to pick the perfect moment. Here's the key concept that will help you understand everything else about these patients: passive flow. After a Glenn, blood from the upper body flows to the lungs by gravity and pressure differences, not because the heart is pumping it there. This is why positioning matters, why these kids might struggle when they cry hard, and why certain complications develop. Understanding passive flow is your secret weapon for anticipating how these patients will respond. Here's the key concept that will help you understand everything else about these patients: passive flow. After a Glenn, blood from the upper body flows to the lungs by gravity and pressure differences, not because the heart is pumping it there. This is why positioning matters, why these kids might struggle when they cry hard, and why certain complications develop. Understanding passive flow is your secret weapon for anticipating how these patients will respond. Here's the key concept that will help you understand everything else about these patients: passive flow. After a Glenn, blood from the upper body flows to the lungs by gravity and pressure differences, not because the heart is pumping it there. This is why positioning matters, why these kids might struggle when they cry hard, and why certain complications develop. Understanding passive flow is your secret weapon for anticipating how these patients will respond. Here's the key concept that will help you understand everything else about these patients: passive flow. After a Glenn, blood from the upper body flows to the lungs by gravity and pressure differences, not because the heart is pumping it there. This is why positioning matters, why these kids might struggle when they cry hard, and why certain complications develop. Understanding passive flow is your secret weapon for anticipating how these patients will respond. Comparison chart showing improvements. Immediate benefits: improved oxygen saturation, 75 to 85%. Reduced heart workload. Better exercise tolerance. Long-term benefits: preserves heart function. Enables normal growth. Prepares for final surgery. Speaker notes: the improvements are usually dramatic and happen quickly. Parents often tell us their child has more energy, better color, and seems happier. But remember, this isn't a cure. These kids still have significant heart disease. The Glenn buys us time and sets the stage for the final repair. It's progress, not perfection. These are the complications that will wake you up at night. Bleeding can be life-threatening. Arrhythmias are common because we're working near the heart's electrical system. Pleural effusions happen because we're disrupting lymphatic drainage. And phrenic nerve injury means the diaphragm doesn't work properly. Your job is to catch these early. Every minute counts. The late complications are more subtle but equally important. AVMs are particularly interesting. They develop because liver blood isn't reaching the lungs, and the liver produces factors that prevent these abnormal connections. It's like the body's quality control system is missing. These complications are why we don't leave kids with Glenn physiology forever. It's a bridge to something better. Head-to-toe assessment checklist. Hemodynamic status. Oxygen saturations. Heart rate and rhythm. Blood pressure. Perfusion. Respiratory status. Work of breathing. Chest tube output. Lung sounds. Speaker notes. Your assessment skills are critical here. These kids can't tell you when something's wrong, so you need to be their voice. Look at the big picture. How do they look compared to yesterday? Are they interactive? How's their color? Trust your nursing instincts. If something doesn't feel right, speak up. These families depend on you to be their advocate. Your interventions need to be as precise as the surgery itself. Pain control is crucial. These kids need to breathe deeply and move to prevent complications. Chest tube management requires attention to detail. Too much drainage is a problem, but so is sudden cessation. And remember, the family is going through this too. They need your expertise and your compassion. SVC syndrome is one of those complications that can develop quickly and be really scary for families. The child's face and arms swell up because blood can't drain properly from the upper body. This is a medical emergency that requires immediate intervention. The good news is it's usually fixable, but timing is critical. Parent teaching checklist. Key points. This is a planned step, not the final repair. Expect improvements, but some limitations remain. Infection prevention is crucial. Regular follow-up is essential. When to call. Fever. Sudden color changes. Difficulty breathing. Decreased activity level. Families need realistic expectations. Yes, their child will likely feel better, but they still have significant heart disease. Dental care becomes super important. Any infection can be serious. And these families become experts at reading their child's subtle changes. Listen to them. They often know something's wrong before we do. The long-term outlook is generally good, but it requires ongoing management. These kids can go to school, play with friends, and have relatively normal childhoods. But they'll always need cardiology care, and most will need that final Fontan surgery. Your role is helping families navigate this journey with hope and realistic expectations. Meet Sarah, 5 months old, hypoplastic left heart syndrome, status post-Norwood at 3 days old, admitted for Glenn procedure. Let's put this all together with a real case. Sarah represents the typical Glenn patient, born with a complex heart defect, survived the newborn surgery, and now ready for the next step. As we go through her case, think about how everything we've discussed applies to her care. Your assessment. What are your priorities? What would you want to know? How would you prepare the family? This is typical for a pre-Glenn patient. The oxygen saturation is lower than normal but expected for her physiology. Her growth is okay but could be better. The increased fatigue tells us she's outgrowing her current palliation. Your pre-op assessment should focus on baseline function, family understanding, and preparation for what's ahead. Sarah's status. Oxygen saturation 85%. Chest tube output 5 ml/kg/HR. Heart rate 140s with occasional junctional rhythm. Parents anxious about swelling around IV site. Discussion points. Are these findings concerning? What's your priority nursing action? How do you address family concerns? Let's analyze this together. The oxygen saturation improvement is exactly what we want to see. The chest tube output is borderline. We worry about more than 10 ml/kg/HR. The junctional rhythm is common but needs monitoring. The IV site swelling could be nothing, or it could be the beginning of SVC syndrome. Your clinical judgment and communication skills are both crucial here. Sarah's progress. Post-op day 5. Oxygen saturation 83%. Chest tubes removed. Taking full feeds. Parents feel ready. Discharge teaching. Activity restrictions. Medication management. Follow-up appointments. Warning signs. This is the goal, a successful recovery and discharge home. Sarah's doing well, but the real test is how she does at home. Your discharge teaching can make the difference between a smooth transition and a readmission. Make sure parents understand not just what to do, but why it matters. Remember these essentials. Glenn is a bridge, not a destination. Passive flow changes everything. Early recognition saves lives. Families need both expertise and compassion. These kids can have great outcomes. As we wrap up, remember these key points. The Glenn procedure is complex, but understanding these fundamentals will guide your care decisions. These children and families are on a challenging journey, but with skilled nursing care, most have excellent outcomes. Your role in their story is significant and meaningful.